Chronic bronchitis. It is included in the group of COPDs, and it is a condition which occurs after the multiple attacks of acute bronchitis for the last 3 months. So it is a chronic disease inflammation due to the irritation produced by the 90% cases are due to the tobacco smoking. The smoke of tobacco consists of hundreds of injurious chemicals that produces irritation, chronic inflammation leading to various complicated diseases of the respiratory tract. So there is narrowing of the airways due to the chronic inflammatory process produced by the tobacco smoke, allergens, environmental pollution by the arsenic, asbestos, nickel, vapors, chemical vapors, especially the inhabitants or the person or the population around the industries and factories. They suffer due to the pollution in the atmosphere or the air. So that causes the permanent damage to the respiratory tract. So chronic bronchitis is incurable, but its symptoms, complaints, hazards, miseries can be controlled and diminished by the various preventive measures and the medical and surgical treatments. So there is not only the active tobacco smoker, but the second-hand smoke is also causative factor one that produces the same pathology in the person which is living around the or having friendship or close contact with the smokers ones. So about 90% cases are due to the tobacco smoke. Symptoms are there is persistent cough with expectoration. The mucus is excessively produced which blocks the airway. In addition to the inflammatory process produced by the immune system of the human body. So there is wheezing, crepitations, painful coughing, tightness of the chest, breathlessness, irritability, palpitation, and also there is edema over the ankle joint, feet, and the legs. There are other symptoms like myalgia, arthralgia, cyanosis due to percentage of the oxygen is decreased because the gaseous exchange is diminished by this narrowing process of the chronic bronchitis. Because the air is not properly exhaled, so exhalation is disturbed, due to which the air is entrapped in the air bags or the alveoli. So that produces emphysema, due to which the exchange of oxygen is lowered, and so there is saturation of the arterial oxygen is decreased. That produces the cyanosis. Now the diagnosis of the chronic bronchitis. X-ray chest, CT scan, then the laboratory test for mucus for the detection of the cytological study under the microscope to detect the various pathogens producing the chronic inflammatory disease, and also to exclude the precancerous injuries or the cells in the airway. Next is the bronchoscopy. It is a electronic device fitted with camera, light that is passed through mouth into the larynx and onwards into the bronchi and bronchioles to study the interior of this upper respiratory tract. Whether this inflammation is non-cancerous, is there any tumor formation, mass formation which is occluding the passage of the air and producing blockage. The mucus plugs, they are deposited and the location is also detected by this device. Then is the biopsy. Through this device, we can also pass an instrument to cut the tissues which we are suspecting. So we study those a part of the tissue which is excised from the respiratory tract and study in the laboratory under the microscope. Next is the spirometry. The forceful inhalation and the forceful expiration volume is calculated by this machine. So that also indicate whether this upsetting or the obstruction or the COPD is due to chronic bronchitis or the emphysema. Whether the pathology is in the airbags or absolutely in the airways. Complication of the acute bronchitis is there is asthma, emphysema, tuberculosis, pleurisy, and the cancer one. So these are the various complications produced by the chronic inflammatory process of the bronchi or bronchus.